Thank you, Catherine, and thank you, Minister, for being here, and thanks to Minister Harris for being before us today. I want to address a couple of points, the first one being in relation to the Rural Ireland document that I guess you've had input into, and Minister Harris has as well, and to say how disappointing it is in terms of the vagueness of what's been done to address healthcare from a rural perspective. And I'll just refer to a couple of things in this. First, in line with mental health and what it refers to. And there is no realisation in here. So it says, in line with Connecting for Life programme, provide support for local strategies across rural Ireland to address suicide and mental health and well-being. Well, the fact is that there are many people presenting at A&E with mental health difficulties. I know many of them myself, and I know their families, and they're being sent home. And young people in particular who are presenting, and these may be young people who have been protected under the CAM system, and sometimes residential patients to CAMs, and obviously they're kicked out once because the criteria around CAMs is so inflexible. Once they reach the age of 18, then they're sent back into their communities, and they refer, time and time again, they're presenting at A&E and being sent home and sent away again without any supports or without any services. And I'm extremely concerned for these people, for these young people and the people who aren't getting seen through A&E. And it's one thing that I would ask you to address in a real and proper way. And as I said, this document is too vague in relation to health. I welcome the fact that it says, but I think it needs much more clarity as well, and needs to be teased out, that there will be extra investment, 435 million for 90 projects in public nursing home and district community hospitals. But my fear is that that is just to address the HICWA requirements, and that we might actually end up with less beds in terms of the HICWA requirements than are there at the moment. And maybe you could just clarify that, of how many extra beds that will mean for rural Ireland. And in particular, does it address problems like where these beds were closed down now, albeit that many of them, including in my own community, were closed down by the Fianna Fáil government in 2009 and 2010, for instance, half of the beds in Balmullet District Hospital were closed. Would it be your intention and the Minister's intention to then reopen those beds with some of this capital investment? Because I think that's the way forward. You see, there's almost a kind of a, and I don't like to use the word schizophrenic, but attitude towards, primary care, we'll invest in primary care, no we won't, then we'll go to centralising and privatising and everything, then back to primary care again. It reminds me a bit of with the Department of Agriculture when they used to put the sheep on the hills and have as many as you possibly can fit there, and then reduce them and bring them back down. So this attitude of where we are in primary care as well, in relation to the models of primary care was first mooted in 2001 when the pilot projects were done. But you will know, even in the boom time, that they were never, ever, ever resourced in the way that they were intended to be, either in the investment in personnel or the investment in technology that's needed to run proper primary care centres. So when you say in this plan again that there are 18 new primary care centres, it means absolutely nothing to the likes of me, because when I see primary care as being some of the pilot projects absolutely not working because the investment hasn't been made, then I think that's a huge failure there. The other thing I want to say to you, Minister, is around cancer patients. There are many, many cancer patients who are not getting their treatment. They're ringing up the hospital when they're to go up for their treatment. They're being told, no, stay at home, we don't have a bed for you, stay at home. It is extremely serious that these cancer patients are not getting the treatment in the way that they need to. I have many other issues, but there's one thing in particular I want to ask you, and within the department, has there been an examination or reports done on an all-island approach to healthcare? Because I very much see that that is the way forward for us. So I'll ask you, have there any reports been done? Has there any scoping exercises been done? And if it hasn't been done to date, could your department oversee a document and a consultation and a scoping exercise around an all-island approach to health. And certainly we will work with you and cooperate with you and Minister Harris in whatever way we can, and our ministers in the north, in whatever way we can, to bring that about, because I think there's huge benefit to be gained by an amalgamation, if you like, of resources under the NHS and under the HSE to provide for, after all, we only have 6.5 million people on this island. We should be able to provide a proper, robust, sustainable health service based on need and based on not on ability to pay. So thank you, Minister, for being here today, and to Minister Harris.